Whether it's a regular checkup with a doc you've seen for years or you're seeing someone new, going to the doctor involves a lot of paperwork. In this Be Your Own Investigator, we've got what to look for in the fine print before you take that clipboard back to the front desk. Some forms are pretty straightforward, and you're asked for your basic information if you're a new patient or if there are any updates since your last visit. Talking about things like contact details and insurance coverage. This is also where you might see something called a consent to treatment agreement. By signing here, you're giving the medical team official permission to provide you with medical care, things like a physical exam or drawing blood. Most should note you have the right to refuse a procedure or treatment or discuss them with your doctor first. This form may also be where you give the office the okay to file claims with your insurance. And speaking of the money side of things, some doctors' offices may also ask you to sign a form saying you've looked at and fully understand their specific financial policies. Things like appointment no-show fees or what happens if your insurance won't pay. Don't be afraid to ask for more details. For example, if you agree to 24 hours notice, ask what that means if your appointment is on a Monday. Finally, one of the most important documents to pay attention to are those privacy forms. Your healthcare information is protected by a federal law known as HIPAA. It gives you primary control over where your information goes and how. These forms usually cover the release of your information in a couple of different ways. One, general sharing of your health information within the practice so they can provide you with care or deal with your insurance company. And two, more specific disclosures, like sharing your information with another doctor's office or your emergency contact. Overall, the advice here is simple. Don't sign something you haven't read. And if you get lost in the medical mumbo-jumbo, just ask the office staff to explain. It's also a good idea to get a copy of all of these documents for your own records. I'm Josie Sturman with this Be Your Own Investigator.
Many medical practices maintain an online patient portal so you can access your medical records on demand. If a provider doesn't have a portal, you would need to request records by phone or mail. Once the request has been made, state laws typically require delivery within 30 to 60 days.